We're actually there on the top. Oh, who was in there? Who are the people? Oh my God, Maharlika is there. Is that Maharlika? That's Maharlika.
Hello, hello mga kasokal. It's Sunday and we're here with another SoCal Pinoy's virtual class. And this is the class that everyone has been waiting for. I mean, it's been a long month. We've been waiting for this class. And here we are. We have Dr. M. Vito Garcia and Dr. Sasha Rarang. And we're here to talk about careers in professional nursing services and educational advancement of Pinoy primer. Let's all welcome Dr. M. Vito Garcia and Dr. Sasha Rarang. Yay!
Hello, everybody. Good evening. I hope you guys are enjoying yourselves and had dinner because, we will help you with this discussion on your digestive process of the dinner that you just had. So we are going to talk about what education means and that the opportunities for every single Filipino out there to explore the world of professional nursing practice. So, I would like to introduce myself. My name is Dr. E.M. Vito Garcia. I have graduated with a doctorate in philosophy, in management, a doctor of nursing practice, and a doctor of health education. I have an MBA in healthcare administration. I have my MSN dual, nursing education and adult gerontological primary care nurse practitioner. I have a master's in education, Master of Arts in Education. I have a baccalaureate degree in nursing. I am an advanced practice registered nurse. I'm a nurse practitioner. I'm a certified perioperative registered nurse, a certified surgical services manager. I am a forensic nurse. I am a legal nurse, and I am a fellow of the American College of Legal Nurse Consulting and a fellow of the International Academy of Addictions Nursing. I currently serve as the founding director and chief nurse administrator for Lake Erie College of Medicine graduate nursing program, and currently also serve about 1,200 staff as an administrator for Encino Hospital Medical Center and Sherman Oaks Hospital. But enough about me, and let us hear from Dr. Sasha Rarang.
Hello, kababayans. My name is Sasha Rarang. I don't have much letters on my name. Well, as you could see, I'm also a doctor. I'm a doctor of philosophy, and my concentration is nursing education, and that's actually paying very well for we are now in the position of being the dean of nursing for one of the colleges here in Los Angeles. It's Angeles College. Shout out to my people there. And also, I've been a in the nursing education for almost 15 years. Started as a instructor to associate degree nursing program, instructor in the Bachelor's of Science in Nursing program, and then became a associate professor to now a professor. And I'm very excited to join the Lake Erie College of Osteopathic Medicine Graduate of Nursing, Masters of Nursing program for being one of the lead faculty. And I'm also a case manager, of course, as a nurse. I've been into a lot of administrative positions in the past. I graduated with a Bachelor's of Science in Nursing degree and a Master's of Science in Nursing to my alma mater, Mount St. Mary's University, and of course, PhD through Capella University, which is online university. Now, did I practice clinically? Yes, I did. I'm a med-surg nurse, also a pediatric nurse. I also have a few stints in the geriatric nursing. And now we're working on something about simulation in nursing and how is that going to actually apply into all realms of nursing disciplines. So that's
Yeah.
me. Research is our big thing that we're doing. I'm also the vice president of the Philippine Nurses Association of Southern California and a member of the Sigma Theta Tau and member of the Association of California Nurse Leaders.
Absolutely. Well, we are honored and I'm privileged to have this opportunity to have and share the video screen with Dr. Arang. But we also would like to acknowledge some of our faculty, the inaugural faculty for the new program for Lake Erie College of Osteopathic Medicine Graduate Nursing Program, Assistant Professor Roland Santos, Professor Cheryl Wagner, and Associate Professor Amibat, who hopefully have joined us today. We'd like also to give our heartfelt shout out to all the nurses, who continuously and tirelessly work, they're behind off in caring for, the vulnerable population, particularly in this very, challenging and difficult time in the advent of COVID-19. And hence the call for more nursing professionals to join the workforce has never been important as today. So, I am going to share my screen, so that we can get with the program. So, again, this is us, and we'd like to focus on 4 key essential topics for tonight's presentation. An introduction to professional nursing services, why Filipinos are the prime representative of the profession. And we'd like to open up this discourse regarding this particular aspect. So I know that Dr. Arang has a historical perspective of why Filipinos. We hear Joe Coy all the time saying, I am Filipino, I'm not a nurse. Because everybody presupposes that when you are Filipino, that you are a nurse. And we as nurses, Filipino nurses for that matter, should embrace that moment because it represents a noble and pure profession. So Dr. Arang, why Filipinos as the prime representative of the profession?
Well, thank you, Dr. Garcia, for that introduction, and thank you for the question. Well, the reason that we have so many Filipinos going into nursing, it's because of, first, let's take a look at our history and who we are in relation to the United States of America. We are the little brothers, it used to be. So back in the early 19s, there were nurses missionary actually that were sent to the Philippines to train Filipinos, and because we became a commonwealth of the United States of America. Since then, when they opened up the education of nurses into the Philippines, the very plan to that is actually to not to only help the Filipino to learn how to take care of their own people, but also so that they could actually utilize these Filipino nurses to be part of the mainstream American nursing uh, labor workforce because of the ongoing shortage even way back then. So when the Second World War actually broke out, there was a need for more nurses, and that is when the training became more intense. And so the training that we've got from our American comrades, American nurses comrades, actually is similar to exactly what they are doing here in the United States. And so when the war is over and everybody went back to their homes, and there was the baby boomer situation occurring into the whole entire United States, then population explosion. We all know that when there's a change in demographics, there's a need for help is inevitably going to change. So what happened is that there is a need for more nurses in the United States because there was lesser number of, I would say, individuals entering the nursing profession. Well, because it is not the most lucrative profession to enter into. Nobody would say, when I grow up, I would like to become a nurse, but somebody will say, when I grow up, I would like to become a doctor, or I would like to become a teacher, but not to become a nurse. It is a grown, it's just like to become a nurse, it's like you've grown to learn that particular profession. So there's something remarkably happening in your lifetime that would change you to why do you want to become a nurse? And so when I'm interviewing students, actually, most of the time they'll say, well, my father was so sick, and being sick, I have to care for my father. And that particular reason is the reason I've seen nurses in the hospital. They're so kind, they're so nice. That leads to the fact that, oh, I would like to become one like them. And that is a heart warming statement coming from people. And so with regards to the Filipino people, when the United States needs more professional nurses to work for them for the for the shortage that is going on, then yeah, they actually allowed us to go. There was a government to government agreement for Filipino nurses to migrate to the United States. And that's the start. So we have in the early 1960s and in the early 1980s, and then again in the 90s, it continues to actually, the United States import import nurses coming not only from the Philippines, of course, but other countries. But we are the number one, we're the largest exporter of nurses in the whole world, and that is a given fact. So another reason why there's so many Filipino in the United States is because once they learn that nursing is a lucrative profession. Why lucrative? It's because it gives you the opportunity to have a decent amount of money. You know, you are being paid fairly for the work that you do as a nurse. And with that, it became a tradition. A particular family would say, I want one nurse to be in the family and to continue, and you can go to America, or you can go to London, or you can go to the Middle East. And so, but of course, it's always been United States is like the number one destination for when you become a Filipino nurse, it should be the United States and no other than that, no lesser than that, actually. So, and I think those are the reasons why we became the bastion of the nursing profession in terms of minority groups. We are
Yeah,
the highest.
and
Yes.
and it's absolutely something, for every single Filipino to be proud of. A nurse, I bet you, the majority, if not all, know a nurse. And I think that, it's simply probably because it runs in our blood.
That's
From
correct.
the
Yeah.
cultural perspective of being the family person that we are, that we care so much for others. We're known to be the most hospitable, people in the world. We show concern, for one another. It's somewhat like instantaneously. Filipinos are all heart, and I think that the profession and the practice of professional registered nursing utilizes the heart. And I think that that is the core, in the core of our being. Culturally, I think that we are so diverse, in our educational preparation. The influences of various occupiers, of our country certainly put in and contributed, to the very fabric of our being. Being, the United States of America open up its doors, for Filipino nurses, because our preparation since elementary, have been the use of the English language. Our commitment to hard work, our dedication and loyalty, certainly represent the core values or the characteristics of becoming a nurse. So, what do you think about other characteristics of why Filipinos are hailed as, the primary care provider, for the ill as well as the well?
Well, it is an innate characteristics for being a Filipino to be so welcoming. We are so welcoming to anybody, even they are not our family or friends. We have all that smile that we actually carry on. And then we are very warm people. Okay. We offer even this food that left behind for our family members. We give it to a stranger if we could see someone who is actually need to eat. And so that caring characteristics, attitude is already an innate for any Filipino. Of course, majority, I would say. I'm not going to say that, of course, every Filipino will be so caring, but it is a majority among us that we are very caring people. So with that and the Bayanihan spirit, actually, that is a tradition handed to us by our forefathers, putting them together, what else can you get? A very caring, nurturing person. And what else could be the best profession there is to actually where you could actually present that characteristics other than nursing. Of course, there are other professions there. Medicine is another one where Filipinos, of course, could go to. And a lot of us also go to medicine because we just happen to love healthcare. But since the ability of an RN to go to the United States, that's actually is created a spark wherein every single individual family in the Philippines suddenly wants a person in their household to become a nurse so that they could send that person also somewhere else. It's because for economic reason, and we have to be admitting that as the fact. So
Yeah, funny you say that, Dr. Rarang, because you know what? I belong to a family of 11 children, 11, and I am one of the 8 registered nurses in the family. So, it runs in the family. I certainly would like to, move on to the careers as a professional registered nurse. You know what? Once you get into professional registered nursing, career, your path and your perspective, for, I guess, socioeconomic freedom, is certainly there for you. We have registered nurses all over the place. We have registered nurses in home health services, right? We have
Correct.
registered nurses in skilled nursing facilities. We have registered nurses in doctor's clinic. We have registered nurses practically everywhere. We do have registered nurses, in CVS, in retail medicine, or even Ralph's when they have, a vaccination program, for example.
And
So,
Disney actually as
oh,
well.
yes, so we
Or
represent.
Carnival Cruise Lines, they have nurses. Yeah.
Exactly. So we represent, a profession that is wanted, that is so desired, and that, that we are so willing to give, so your prospect in the practice of registered nursing is, I think, limitless. Do you agree, Dr. Rarang?
Oh, 100%. Yes. There was an adage that says that nurse, one profession with a 1,000 jobs. So yeah.
Yes, and you know what? We can always, as long as you have that passion to serve others, as long as you believe in the development of yourself, as long as you have that commitment, for service, I think that you'll be all set. The evolution of nursing, who knows that we'll have a legal nurse that represent, social justice, in the courts. Who knew that, nurses will develop electronic means and artificial intelligence, to provide information that informs, persuade, and even entertain people. So I think that the careers as a professional registered nurse, is absolutely limitless. You can explore the world with it. We have the International Council of Nurses. You have very specialized areas. Our graduate of nursing program, which is the Master of Science in Nursing Clinical Nurse Leader, prepares the individual to be that well-rounded registered nurse that could tackle not only clinical, but also leadership, educational, and administrative challenges and difficulties in this day and beyond. So, Dr. Arang, educational pathways to the practice of professional registered nursing. I've known you for decades, but I would just want to, for you to give us a snapshot, of the nursing programs across, that are all
Across the
offering.
continuum.
Yes, throughout
Yes.
the continuum. So
Absolutely.
would you,
So you're very right about saying that nursing is remarkably very flexible career, and for someone who's intending to enter the nursing profession, of course, to practice nursing, you have to pass the NCLEX RN, okay? And there are two main existing pathways in the undergraduate level, which will actually allow you to be licensed as a registered nurse. Those are your associate degree in nursing, and the second one would be the baccalaureate degree in nursing or bachelor's of science in nursing. So those are the main two pathway. Now, there are still existing diploma nursing at this point, but there are not so many of them. But so I would just say associate, and you could actually get the associate degree program from community colleges, from private colleges that are actually offering career type of programs. And then you could also get it from a university, okay, as an extension of their programs. Now, with the baccalaureate degree nursing program, definitely you have to enroll in a major university to actually get that particular degree. All of this, both of them actually include sciences, communication, and also what are the other ones? I think the core nursing courses will prepare you to actually sit for the NCLEX RN. And then later on, once you completed your undergraduate programs, you could actually, for those who are actually graduate of the associate degree nursing programs, in order for them to complete the the journey towards becoming a baccalaureate degree holder in nursing, they could actually go into programs such as the RN to BSN completion programs. Okay, and majority of these programs are actually online. There are some that actually also done residentially. Okay, you don't have to have anymore your clinical at that point because you completed all the clinical requirements while you are in your ADN program. Now, in terms of the graduate program, so once you completed your BSN, you could actually go to your Master's of Nursing degree, okay, a program that actually allows you to learn further the skills, the knowledge, furthering the idea of nursing science. And after that, um, in that particular area of study, the Masters of Science in Nursing, now you can branch out to your to any kind of specialty that you actually, as an individual, would like to become an expertise. You have your nurse practitioner, you have your clinical nurse specialist, you have your Masters of Science in Nursing, nurse midwife, nurse anesthetist. So all of this group nurse practitioners, for example, are considered to be advanced practice nursing. And then within the nurse practitioner area, you could be either a nurse practitioner gerontology, nurse practitioner maternal women's health, you have pediatrics, you have mental health. I'm actually looking into that at this point because we are considered to be a lifelong learner. So, especially now in California, that there's a new law that actually been passed that actually now given the total autonomy for a nurse in 2023, actually, to a nurse practitioner to practice with autonomy. Okay, so and then another type of nurse practitioner would be the nurse anesthetist, also still nurse practitioner. What else? The other one that I'm thinking of, I think midwife, pediatric, family nurse practitioner, of course. We don't have to forget that one. And then after that, you could in the Masters of Nursing, you could also become a nurse educator track, or nurse informatics, or is there anything more, Dr. Garcia, that I
Yeah,
forgot?
the clinical
The
nurse lead.
clinical nurse leader, of course,
Yeah,
and we have
of
at
course.
LICOM. We're promoting that. It's very important for us to see what you really like to do within the profession, because you have to assess your heart, what you really want to do. And as a nurse, I would say between a leader and a clinician, what else could there be off than to become a combination of a nurse leader who is a clinician? So we have the clinical nurse leader, and then we have the nurse educator. So at LICOM, I think we are actually now trying to engage other nurses now to become more diversified into, there's more things to choose from. So yeah.
Yes, and don't forget the doctoral programs,
Of course.
Dr. Rarang. So really the educational pathways. If you want to be a registered nurse, just like what Dr. Rarang has said, you can enter an associate's 24-month program. That is absolutely clinically heavy. Your baccalaureate degree, that is your 4 years, although there are some programs that are 36 months. I would, recommend the full 4-year program to provide you with a full spectrum of what, nurses really, really do. You will, of course, to be able to use the RN initials next to your name, you have to have passed the national board examination. This is what Dr. Rarang was referring to as the NCLEX RN program. And then, you know, you move on to the graduate. It
Right.
is really to hone, you know, and to becoming that expert registered nurse in which a particular specialization that you are, or a focus of what you want to practice. The law that Dr. Orang has referred to earlier is the Assembly Bill 890. That is
Thank you so much.
2023.
Yes.
And that is absolutely allowing, you know, advanced practice registered nurses, or APRNs, i.e. nurse practitioners, you know, in particular, you know, to practice without physician supervision. So that is coming. They are forming currently a committee that is represented by nurses, but at the same time have invited 2 physicians to sit in that committee to provide a safety oversight, you know, into the treatment plan. Remember, registered nursing is an autonomous discipline because we actually work under the Nurse Practice Act of each state. So Dr. Arang stated earlier, clinical nurse leader or the graduate nurse program, it's really, you know, you become 360. You know, the healthcare problems really comprise of 3 domains, right? One is access to healthcare. Second is the quality of services in healthcare. And 3 really is finance. And these 3, you know, domains of healthcare problems are the focus on the competencies of the graduate nursing program in clinical nurse leader.
Right.
Now, in doctoral nursing, you know, practice, you know, you have 2 tracks and many tracks. There are so many, you know, you have the nursing doctor track, you have doctor of nursing science, you have doctor of nursing practice, you have a PhD in nursing, you know, so like Dr. Arang is in, her PhD is, you know, in nursing education. So, you know, and her research is focused on high fidelity, on how to strengthen and develop cognitively, you know, registered nurses to become, you know, the nurse researchers and the critical thinkers that they are, you know. And I think that, you know, in the area of educational pathways, being a registered nurse is never easy. You know, it is always, you always have to practice discipline, or else you'll never make it out of nursing school. And we always preach to our students, you know, to always be mindful of your responsibilities as students, both in the clinical area as well as in theoretical or conceptual area. And it's never easy. You will have, you know, crying moments, you will have hopelessness, you will have despair, but always remember that your nurse administrators are always there for you, to support you, because we absolutely want you to be successful. So having said that, Dr. Arang, you know, there are thousands of schools of nursing in the nation.
Right.
So, you know, what about the prospect for quality? You know, we wanted Filipino nurses in particular to be subject to the quality educational experience. And I think being in academia, you know, for quite a long period of time, and me being in service and in academia as well, I can see the balance that is needed to ensure that there is quality in nursing education.
Yes.
Any comment on that, Dr. Arang?
Absolutely. We are in the needs of exploring on how can we actually promote quality and safety education in nursing? Uh, Not too long ago, we have the QSIN organization actually uh, introduce us into this particular concept. And that particular concept of QSIN, also known as your quality and safety education for nurses, is actually a initiative that actually is spearheaded by the Institute of Medicine together with the other foundation, I think Jonas Foundation, and other, of course, authorities in the nursing profession to ensure that safety and quality of nursing practice is going to be in place. So there were so many studies done. There were so many pilot initiatives completed by different colleges and universities all throughout the nation. When it comes to the prospect for quality, knowledge discovery, skills development, and behavioral cultivation, let's start with prospect for quality. For a student who would like to actually go into a quality type of nursing program, they have to look at a different factors. The NCLEX pass rate of a particular program is your benchmark on how you're going to make sure that that particular college is, of course, of a quality. The second is the faculty lined up. You want to make sure that you have to look at who are the teaching faculty, the available clinical space for a particular program, because that's important. You were saying about how could you actually practice to be create a good nursing practice if you do not have actually a realistic hands-on, okay, um, and you actually went and performed the actual hands-on of patient care with a critical thinking um, ability that leads you to develop clinical judgment. So all of these are all supposed to be together in order for you to develop a quality program. And as being a dean of nursing, that is my goal, is to make sure that when my students are going to be in my program, for example, that they have the right lineup of faculty, they have the right uh, clinical placement. We have all the resources. And speaking of which, you have to have now your simulation and different types of programming, virtual programming, virtual simulation, all of those additional types of strategies to promote critical thinking. Because in the future, we're going to be putting all of these graduating nurses in the undergraduate program into the new generation NCLEX by year 2023 as well. So we in the academia should be looking into the prospect for quality. And there you go, the faculty, the curriculum, the clinical space, and of course the school. The school's reputation is very important, because if the school created that reputation of being graduating people or individuals who are going to be successful in that particular program, then okay, that that particular program is uh, a quality program. And LICOM, definitely, based on its history, and the lineup of faculty, definitely you could say that it is a quality program, although it is just barely starting at this point. But you can tell that who are the people actually within that program, who's running the program. Of course, Dr. Garcia is there, Dr. Orang is there, Dr. Blood is there, and so many more. So yes, with the knowledge discovery, you as a nurse, you shouldn't be ending up in the baccalaureate degree level, because as a BSN graduate, what you do is you are the user of the research that is being produced by the doctorate or doctoral students, or whoever actually completed their doctorate program and went into research, because they are they are the ones who's actually doing this inquiry. Okay, somebody has to have an inquisitive mindset in order for them to develop new knowledge. And research is now termed as the evidence-based practice that we all hear in all parts of nursing. But where is that evidence-based practice actually coming from? Well, it's coming from, we do not practice nursing because of hearsay. We do not practice nursing just because your mom told you so. Okay, so if we apply Vicks, for example, in the sole of your foot, okay, in your soul, there's a reason for that. And if you are a nurse researcher, you want to know the reason. How could that particular phenomenon would actually stop the cold or flu with a Vicks? So maybe somebody's hearing me, maybe we have to look into it, because Jokoy actually talk about that. And so we need to look into that. You cannot just go, if you're a nurse, if you are really into the scientific way of practicing nursing, you have to rely on evidence-based practice.
And I think that is very, very important note, Dr. Orang, when students, particularly Filipinos, are looking either to pre-licensure, registered nurse program that is before you get licensed, that is your 2-year BSN or BSN program, or the graduate nursing program, for us, the MSN Clinical Nurse Leader program. Actually, you probably have an upper hand because, you've got the majority of your professors who are very committed and dedicated, to really raising the Filipino American flag, to produce more, conscientious, highly responsive, and highly accountable graduate registered nurses, in advanced practice, to really create change and really impact the lives of the people that we serve, and at the same time always make a difference. In today's practice, Dr. Orang, skills development is so important. Critical thinking skills, is really the crux of why patients are kept alive, and why these patients actually do get to the rehabilitation phase of the disease and the disorder recovery. The hands, the mind, the heart, the feet, your back, on how to make sure that we maintain the whole person, in creating and developing those particular skills require some work. And, that work actually advances as we experience cases, heart failure, kidney failure, liver failure, multi-organ system failure. I know that Dr. Sherwin Imperio is listening. So, the disorder of the mind, the disorder of the brain, the disorder of the behavior. These are, the skill sets that are required for you to be able to render care to your patients. The knowledge discovery, we owe it to the researchers and the discoverers of evidence-based practice, and the behavioral cultivation is essentially from changing, your thinking and the manner in which you behave into the professional being that you are, that provides this very noble, honest, and very trustworthy services. Nurses have always been regarded as the most honest and the most trustworthy profession, for so many years in a row. Do you agree, Dr. Orang?
Absolutely. You're talking about the skills development. When it comes to skills development, I think there's always that practice. So socialization to the profession is one of the most important thing that we need to consider imparting our students, because with the socialization to the profession, it means to say that they're going to learn. When you say socialization, it's not about being socializing in the nursing. It's mean that we're going to direct them to the right category, right type of skills that they're supposed to learn. And from skills lab all the way to the simulation, all the way to the actual clinical practice. And for a particular individual nursing student to observe the right attitude of the nurse that is actually model the right kind of behavior, because of course we don't want to become a nurse Rashad, right? So we have to make sure that our graduates are going to learn the right type of skill set. Okay, and in the development of that skills, we as educators are responsible for ensuring that they are getting that in the during the time of their training. So I really encourage all of the nurse educator out there that if you are with your nursing students, to make sure to guide them, mentor them, um, help them learn the right way. Don't eat your young. That's what we need to do to our colleagues. Not to harass them while they are actually in their training. So the quality of their education and the quality of their behavior is based on how they actually get socialized into the profession. So behavioral cultivation is very important. This is a new term that I'm learning today. Cultural behavioral cultivation is something like you're actually getting out of your home, and the way you're going to actually present yourself in the public is how you actually discipline at home. So we need also in the nursing profession to promote discipline among our nurses, among our graduates, so that we could actually create a discipline, a nurse, a professional discipline that actually embodies trustworthiness, honesty, collegiality, and all of those good adjectives that one could actually present as a good nurse. Not
That's
just
right.
the skills, right, but
That's
the
right.
behavior.
That's right. That's right. And absolutely. And I think, in the School of Nursing or your nursing program, you learn medical, surgical nursing. You learn psychiatric nursing. You learn pediatric nursing. You learn maternal and child nursing. You learn a whole gamut of nursing concepts, that will prepare you to tackle the problems of the real world. And, the graduate nursing program is an elevation of that knowledge and skills, as well as the behavior that you have gained throughout your undergraduate or associate nursing program. So I truly, truly appreciate everybody's time, because we would like to have some time, to answer some of the pressing questions, of our audience. And we're here to answer any more. We are actually faculty and professors of nursing science, for Lake Erie College of Osteopathic Medicine. We are launching our Master of Science in Nursing Clinical Nurse Leader specialization. We're going to talk about all the advanced concepts, in theories, advanced concepts in healthcare economics, advanced concepts in law and ethics, informatics, research, and evidence-based. Believe it or not, you're going to have graduate statistics, advanced pharmacotherapeutics and advanced pharmacology, advanced pathophysiology, advanced health assessment, and all of the essential knowledge for the clinical nurse leaders, to make you be cognizant and appraise competencies, in transformational leadership, in quality services, as well as, believe it or not, epidemiology. So this is really clinically driven, that has sort of like translation into leadership so that you can create a change and make an impact to the healthcare in today's world. So, we would like Dr. Arang and I, thank you, Dr. Arang, for joining
Thank
me
you so
today.
much for
But
inviting me. Yes,
yes,
part of
definitely.
the
So, we'd
program.
like to have some time if there are questions from the audience. I turn it back to you, Mick.
Hi. So we do have some questions. One question is from John Eric Pabalan. He was asking about the ROI from BSN to MSN. And considering, money may not be the main factor, we still want to know what the ROI is. If you're moving from BSN and you're taking MSN, what's the rate of increase in salary?
Shall I answer that question?
Well, yeah, because this is actually there are so many aspects, to the return on investment, your ROI. Number one, there are two dimensions, as I see it. One is, the professional satisfaction, contentment, and advancement, that you feel satisfied because of the fact that you have a master's degree in nursing. That is one aspect. Some people will gravitate to that aspect. And the second is really economics, familial or personal economics. There are many, many institutions out there that actually have degree differentials. You can have degree differentials for gaining a graduate degree, right? You are actually, can earn more, if your trajectory and your passion leads you to leadership roles, that creates an impact in a micro system or the macro system, and that could create an impact. Say, for example, a registered nurse, makes 75,000, for example, a year. The prospect of the leadership trajectory that has clinical component and knowledge, would probably increase a minimum of 15 to 25% of your base salary. And that is just entry level to leadership. So, but I hope that it is a balance and a combination of personal and professional gratification, but at the same time, taking care of your personal economics or familial economics.
Actually, I also would like to add to that, Dr. Garcia. It's about diversification. So once you actually go into a higher learning from your BSN to your MSN, as an MSN graduate and with an expertise, you have more chance of getting into a different field, especially, for example, if you are a BSN grad and you are practicing in med surg, and now you would like to enter into an MSN with a Masters of Science in Nursing, nurse practitioner in mental health, for example, as an example of area that you would like to become expert in the future. Now, you're not only having one expertise in nursing, but two. So that will give you the additional qualification, and then you could actually teach in the university as a faculty for mental health. So it's getting into the MSN program is like opening windows or doors to someone into the field of nursing. So I encourage everybody to actually go to higher learning. Okay. The ROI is so much, it's tremendous. You cannot actually, it won't stop year by year. You're gonna get that return of investments.
Yeah, yeah, absolutely. Like my trajectory, I was a critical care nurse, emergency room and trauma nurse before I become an OR nurse. And then I dabbled into so many specializations, that actually helped propel me, to knowing, the various clinical areas. And I know that we have audiences that actually really, wonder, he's the administrator of, the hospitals. Why does he still go in the operating room and assist surgeons? It gives me that freedom, that instead of looking just how we can develop more services, sometimes I just needed to get to the trenches, roll up my sleeves and be among, the nurses that actually, really are the heroes of our healthcare. Any other question, Mick?
Thank you so much. You guys are so inspirational. I do have a question from Oliver. So, since we've been talking about schools and all of the different areas within nursing, we want to know what are the schools in terms of what schools would you recommend in terms of graduation rates, high graduation rates, and high pass rates for the NCLEX, and also tuition fees. They just want to get like a short list of schools.
Okay, we are, I just with the spirit of fairness, I know that I have published Dr. Rarang's, as the Dean of Nursing to one of the colleges, but, I would refrain, from recommending a school. However, I would say if it is a pre-licensure program, because you are going to commit to your future, you really need to sit and draw, specifics, and really search the internet. Dr. Rarang has spoken about reputation, has spoken about the board pass rates, and the clinical space, that will prepare you to practice as a registered nurse. So honestly, it's an individual choice, but hopefully when someone in your family has, graduated already with their bachelor's degree, they will come to LECOM, Lake Erie College of Osteopathic Medicine MSN program for the clinical nurse leader, because we have developed the Filipinos, developed that first program for that school of medicine. But it's an individual choice. How about you, Dr. Rarang?
Well, actually, I would consider this is one of this big discussion about students actually coming from the being an immigrant, for example, or being a Filipino American born here in the United States. I think there's what you call affinity. As a Filipino, you have to love your own. You have to love your own, is what I'm saying. So meaning to say, I don't have to say the word, I don't have to say the school. You know where to find me in case you need some advice, and maybe I could talk you to come to the program that is appropriate for you. But of course, I have my colleagues out there also, the deans of nurses and directors of nurses for entire California. They have their schools in the BRN website. It's actually listed in there, their pass rates. More likely you have to do your homework. You have to call every individual school, look at the tuition fee, all of the miscellaneous fees, the lineup of their faculty. Maybe you need to ask the graduates. Maybe you need to attend one of their information session, so you could actually learn which school to go to. But take time. okay, you have to take the entrance examination, go to all of the school that you like and see who actually will actually going to take you, because getting into the nursing program nowadays is like a prime commodity in the undergraduate program. But when it comes to graduate program, don't forget LECOM, Lake Erie College of Osteopathic Medicine
Dr.
graduate
Rarang.
program.
Yeah, yeah, absolutely. But always remember though, I just wanted to caution everybody that there is still a lineup, a waiting period
Yeah,
for for the Los Angeles community colleges that has
it's
associate's
given.
degree
Yeah,
program. A long list.
it's a
So
given.
your best bet truly is to really look at the demographics, because you don't want to be driving an hour and a half, to
Correct.
go to nursing school. You don't want to, so the proximity and the demographics of the nursing schools that surround you is a factor to consider. And then all of those, qualitative data that you could find from that nursing school, you need to actually really, really draw if you are going to commit, because it will be your money, it will be your blood, it'll be your sweat. So, you want to make it worthwhile. Again, I caution everybody that the associates program for the Los Angeles community colleges or any other community colleges
They're
remain to
long.
have a long waiting list. So your best bet really is
Oh,
private
they
school.
have to look also at their GPA. They
Yeah,
have to look also at their previous experiences, and that's why, and also their entrance examination scores, because all of these are going to be a compounding factor on their success of going into a nursing program. Dr. Garcia is talking about the long waiting list among our colleagues in the community colleges, which is true. Now, you could actually look into the private colleges also and see which one actually uh, is close to your needs. It's all about your need. Again, demographic, the distance of the program. Do they provide online programming? They're actually even the campus, you have to look into that. Don't be persuaded by the campus alone, because of course all of us are innovating our campuses. We actually make it so beautiful, because aesthetic part, we have to stand out. But what's inside, what is the substance of the school? That's what you need to look into. Okay.
yeah. Mick, any more, Mick?
Yes, I do have another question from Oliver. So he is asking about clinical documentation improvement, and he said it's a new field for RNs, and it, given that you're an administrator at two hospitals and you're a founding director of Lake Erie College of Osteopathic Medicine, and Dr. Rarang is a dean in Angeles College of Los Angeles. Do you have a pathway or a program for clinical documentation improvement?
Mm-hmm.
Actually, Dr. Orang is a certified case manager. So, she's all about clinical documentation, right? But, it is an evolving field where nurses takes, takes the driving seat. This is really about the quality of documentation, evaluation, review, collaboration with, primary doctors, specialists, on how clinical documentation should be done. There are nurses, are primary and evolving into this role. So if you are, and the switch to becoming CDI, or CDS, the clinical documentation specialist, you can, delve into that particular practice. If you have nursing informatics as your passion, you create this clinical languages that are acceptable. We have to be sure that we are that our documentation is in congruence, with what's allowed, with the health plans as well as the CMS, and nurses are given that opportunity, to become CDIs and CDSs. But I can tell you that, a lot of foreign grads and offshore, review, meaning, the CDIs and CDSs are contracted somewhere else other than the United States, are being made at this point in time. So, but a very good question, Oliver. Thank you.
Oh, thank you so much. And I think that's about all the time that we have. We're actually 5 minutes over our time. And Dr. Rarang and Dr. Vito Garcia, do you want to tell our viewers where they can reach you in case they have more questions for you?
Sure, absolutely. So I'm going to give my personal email since, we're all family in SoCal Pinoys. So, my personal email is Dr. DOCTOR, capital E, capital M, 1974 at yahoo.com. And you can actually reach me also at the at the college, at eGarcia, EGARCIA at LECOM, LECOM.edu. So Dr. EM 1974 at yahoo.com or eGarcia at LECOM.edu. Please peruse our website for the Lake Erie College of Osteopathic Medicine. That is www.lecom.edu. To you, Dr. Rarang.
Well, same thing, because I don't have yet my official LECOM email, but you could use my personal email at Sasha, which is SASHA Rarang, RARANG at yahoo.com. Should I let them actually also email me on my own school, if
Sure.
ever? Absolutely. So thank you so much for that opportunity. So it's S Rarang, RARENG at angeluscollege.edu. So there you go. Thank you so much.
So Mick, yeah, so I hope that we have given you a glimpse of, what professional nursing is all about. And, I think, we hope that we could, persuade you, to enter the profession because, it's never enough. We always say every single patient deserves a nurse. So you know what? And you know how many people are in the world. So, so that means that we are still in dire need of registered nurses, particularly MSN or graduate prepared nurses, to tackle the problems of the healthcare system.
We need more nurse faculty. So if you would like to become a nurse academician, please, you have another track, your nurse education track in the MSN program. One of the reasons for us having a shortage of nursing is because we lack the qualified nurse faculty. So please, this is where it starts. Then you could become a nurse leader as well. So don't forget.
There you go, Mick. In behalf of Lake Erie College of Osteopathic Medicine, go SoCal Pinoys. Thank you very much for the opportunity. Dr. Rarang and I hope to have you in our classes.
More power, SoCal Pinoy.
Is that me personally? Yes, thank you so much. So on behalf of all of the members of SoCal Pinoys, I want to thank you, Dr. Sasha Rarang and Dr. M. Vito Garcia, for gracing our virtual class. This was such an awesome class. I'm totally blown away. I've never learned so much in an hour about nursing, and I literally learned so much, and there's just so many areas of nursing that I didn't know about. And there's so many opportunities that await people who want to become nurses or academics in nursing. And so thank you so much to both of you. And that was such a great class. This is such, thank you so much for your time and giving us invaluable information. And before we go, I just have some reminders and announcements for everyone. So let me share my screen.
So Mick, please,
Yes.
keep everybody safe. Social distancing is a thing still. Wear your masks. We don't want to see you in emergency rooms. Always remember, to wash your hands. It's still the most effective way to keep the virus away. And always, and get your flu shot this year. Get your flu shot.
Yes, thank you so much for those reminders. And I have my own set of reminders. And so next week, next week on Wednesday, we have our very first SoCal Pinoy's Zumba class. So that's from 7 to 8 with Jordan Jimenez. He's actually a certified Zumba instructor, and he has Zumba class every day. And so for this one special day in October, he's going to do a 1-hour session for us SoCal Pinoy's members. And so that's something that we should go to because we've been eating so much from all of the good food of our vendors. And then the next one is on Saturday. That's on Saturday, October 23, I believe it is. October 24th, Saturday at 1 p.m. So Rowena Similar, she's the author of Rom Rom and Lola. And so she's an author of this published children's book, and you can find it on Amazon. And she's going to do a live reading for us SoCal Pinoys. And so bring your kids to this class. This is a kid-friendly class. It's specifically designed for children. And so Rom Rom and Lola author Rowena Similar. That's on Saturday at 1:00 p.m. And then, so yeah, we literally have 5 more classes to go this October. So I hope to see everyone. And we have a special guest like right here where there's no picture. So that's gonna be something. It's going to be about Forgotten Luzones, the first Filipino. So yeah, let me know if you guys know who it's gonna be. I'm not showing a picture yet. So yeah, and that's about it for now. And let me go back to the screen where you can see Dr. Sasha Rarang and Dr. Mbito Garcia. Thank you so much.
Thank you.
Thank you.
And I'm sure you'll be getting a lot of questions, and I'm sure you'll be getting a lot of inquiries on admissions to each of your schools for the nursing programs that you offer. And we'll see you soon. So thank you and have a great rest of the weekend. It's Monday tomorrow. Let's all get some sleep and get ready for the week. Yeah. Thank you so much.
Thank you.
Bye, everybody.
Good night, everybody.